The Fertility Friday podcast is supported by the monthly women's kit by Dow Labs. Dow Labs is making Chinese herbal medicine more approachable, convenient, tasty, and accessible. Head over to mydowlabs.com and use the code FERTILITY for 20% off your first order. Again, that's mydowlabs.com, mydowlabs.com. This is the Fertility Friday podcast, episode number 194. Welcome to the 194th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I've got a great show for you today. I'm excited to welcome back Dr. Marguerite Duane to the show. So Dr. Duane was on the show back in episode 123 talking about the effectiveness of fertility awareness-based methods and also the programs that she teaches. So she teaches doctors about fertility awareness, which is really incredible. And I know as a listener of the podcast, that is exactly what we want more of. We want more education to our health providers so that they can support us in wanting to understand our menstrual cycles. So this is officially the last call for the 10-week Fertility Awareness Mastery Group program. The doors are closing. So if you're listening to this in real time, the doors are closing pretty much now because we're actually going to get started next week. So head over to fertilityfriday.com/group program if you want to, jump in under the wire. And yeah, if the registration is still open when you get there, you'll see it on the website. And if not, you'll be able to jump on the waiting list for the next round. And before we jump into today's episode, I wanted to take a moment to thank our sponsor, Dow Labs. Now, Chinese medicine is a 2,500-year-old practice that encompasses everything from acupuncture to meditation and herbal medicine. And Dow Labs is committed to making Chinese herbal medicine more approachable, convenient, and accessible for the modern woman. And with that in mind, Dow Labs has developed the Women's Monthly Kit as a way to gently bring the menstrual cycle back in balance. The Women's Monthly Kit is made up of a classic combination of two incredibly powerful and popular formulas, Emotional Balance and Women's Formula. Now, Women's Formula is designed to be used in your pre-ovulatory phase. So after your period stops, that's when it's specifically designed to be used. And then Emotional Balance is intended for use as you approach your next period in your post-ovulatory phase. So together, these two formulas support hormone balance and cycle regularity. And considering that they're made from traditional Chinese herbal formulas, they actually taste pretty good. I've tried them myself. And so for more information, make sure to head over to mydowlabs.com for information about the Women's Monthly Kit. And be sure to use the code FERTILITY at checkout to receive 20% off your first order. So again, that's mydowlabs.com. Now let's jump into today's episode. And I'm very excited to welcome my guest, Dr. Marguerite Duane, back to the show. What's exciting about this interview is now, Dr. Duane, I've met you in person.
Yes, it was a pleasure.
Yes. So we attended the Justice Conference together last year in August. And so it's really great actually to be chatting with you again. So for those of you who aren't familiar with Dr. Duane, I'll link our previous episode in the show notes. But Dr. Duane is a board-certified family physician. She's the co-founder and executive director of FACS, which is the Fertility Appreciation Collaborative to teach the science. It's an organization that's dedicated to educating healthcare professionals and students about the scientifically valid, natural, or fertility awareness-based methods of family planning. So we love Marguerite because she trains doctors to really understand fertility awareness. So I will spare the long bio. I'll let you share more about what you do, Marguerite. And also for the listeners who want to hear a little bit more about your background, they can also listen to the first episode that we did together. But in this episode today, we're really going to be talking about the science behind fertility awareness-based methods and how to reach a lot of those medical practitioners. So we're really going to be delving into a lot of those topics. So welcome to the show. Welcome back to the show, Marguerite.
Thanks. It's such a pleasure to be back with you again, Lisa.
Well, thank you for coming on the show again. And so maybe before we jump into our topics of the day, you could share a little bit about your history and background in fertility awareness, because you're a trained Cretan medical consultant.
Mm-hmm. Yeah, so I actually did not hear the term fertility awareness or charting or natural family planning until I was a first-year resident. So I had graduated from medical school and did not learn anything about the whole concept of charting the female cycle until I was a first-year resident. And at that time, one of my senior residents was also trained as a Cretan medical consultant. And we were discussing the different side effects of various forms of family planning, including hormonal birth control and IUDs and barrier methods. And she said to me, well, did you know there are some methods of family planning that women can use that have no medical side effects? And I looked at her and I was shocked. I'm like, well, no, everything has side effects, whether it's, increased risk of blood clots with hormonal contraception, maybe increased risk of infertility or ectopic pregnancy with IUDs, and even just reactions to using barrier methods. And she said, well, no, actually, there's a whole group of natural or fertility awareness-based methods. And these are methods where women can learn to chart observable signs that indicate when they're fertile and when they're not. And they can use these methods to avoid pregnancy and to achieve pregnancy. So she said, in fact, they're really true methods of family planning because you can use them either way. And at that point, I was 29 years old. Myself had been cycling for almost 2 decades. And I thought to myself, how have I never heard about natural or fertility awareness-based methods? So that sparked my interest in this topic. And over the next decade, I just began to read and learn as much as I could. But unfortunately, there's not a ton of information out there. There's not a lot of research that's done. And so that's what led me to do the Cretan medical consultant training, because at that point, about 10 years ago, that was the only form of training specifically geared towards medical professionals who are interested in learning more about natural or fertility awareness-based methods. So I was excited to have the opportunity as a doctor to learn more. But I discovered for the general population and for practitioners, there are a lot of different methods that you can learn to teach and to be trained to use, depending on your interest.
Well, and this is the topic of doctors and their level of education around this particular method of birth control has been a topic on the podcast a number of times. So it's something that you and I spoke about in our previous interview. And I interviewed a female doctor, Dr. Miranda Naylor, several episodes ago. So I'll link that episode in the show notes as well. And the reason I interviewed her is, in her situation, she reached out to me because she discovered the podcast. Now, she's a practicing medical doctor, and she realized that she hadn't learned about her own cycle in her training. So she's in her practice prescribing hormonal birth control and really not aware of the methods. And what was interesting about that interview was that she shared what her training and experience was like in medical school to really give a sense of, how doctors are trained, how doctors look at these situations, and why often many medical doctors are not discussing fertility awareness-based methods. So maybe you could share a little bit about your experience in medical school and now your experience training doctors. Like, what is that like?
Right. No, that's a great question. And I think it is important to realize for your audience that if you have a doctor that is not supportive of your use of a natural method or is not familiar, it simply may be that they never learned about it in medical school. As I mentioned, the topic was never discussed when I was in medical school. And one of the projects that FACS is working on right now is we are doing a research study to look at what topics are covered in medical school that relate to family planning and women's reproductive health. So our goal is to look at the curricula in all of in as many medical schools as possible to see what topics are they discussing. Do they discuss different forms of hormonal birth control? Do they discuss the use of IUDs? Do they discuss the use of IVF? Do they discuss the use of NAPRO technology? Do they discuss the use of the Billings ovulation method or the symptothermal method? So our goal is to try to tabulate to see if medical students are even being exposed to this information. And our hypothesis is that the natural or fertility awareness-based methods are likely not being talked about at all in medical school. We did do a research project back in 2012 where we looked at what is being taught in family medicine residency training programs. And at that time, about 25% of them reported that they did not teach anything at all about fertility awareness-based methods, which isn't surprising. And as a result, research shows that less than 10% of obstetrician gynecologists and family physicians are even familiar and knowledgeable about fertility awareness-based methods. Not only their effectiveness for family planning, whether couples want to use them to prevent pregnancy or if their goal is to achieve pregnancy, but there's really been very little discussion about how these methods, how charting the cycle can serve as the fifth vital sign for women to understand their cycle and to potentially work with a trained medical professional to identify potential issues that may need to be addressed. So there's really a gap in the medical education process. And unfortunately, many physicians like myself will do continuing medical education programs, will attend conferences. But again, there's very little information about there for medical professionals. And that's why we launched FACS. And now we actually host webinars every month, including 2 continuing medical education webinars for medical professionals so they can learn how fertility awareness-based methods can be used for family planning, as well as how fertility awareness-based methods can be used to serve as the fifth vital sign for women.
Well, and I think it's really important to highlight the why. Like, why is it that physicians aren't aware of this? Because as you know, I mean, you're a woman who went through the process of discovery around all this information, and you went through this process at 29. I know how angry I was, and I was 18. So I think it's really important to ground the discussion in an understanding of where your doctor is coming from, and an understanding that from what I've seen, even though we're still seeing that most physicians don't have a good solid awareness about fertility awareness-based methods, they're still trying to support the women that they're working with in the ways that they've been taught. So maybe you could just talk about the implications of what you're saying, which is that very few doctors have even been exposed to it.
Right. There are very few physicians and medical professionals that are familiar with fertility awareness-based methods. And I agree, most medical professionals really do want to do what's best for their patients. But let's talk about it. Why are doctors and nurses and midwives and PAs not learning about fertility awareness-based methods? And I think the answer is threefold. I think one has to do with money. You know, fertility awareness-based methods are really a very low cost option when it comes to family planning. Certainly women do need to invest in learning the method, ideally from a trained instructor in most cases, because if you're having any issues with your cycle and your signs being confusing, it's important to have a trained instructor that can help guide you. Also, most of the effectiveness studies of fertility awareness-based methods were done in women that learned from a trained instructor. So if you hope to achieve the best effectiveness rates, it's important to learn from a trained instructor. But other than that initial investment up front, and other than the Marquette method, which does use the Clear Blue fertility monitor and those test strips, most fertility awareness-based methods do not require a significant investment. And as a result, they're not really a profit-generating center. The birth control industry, the hormonal birth control industry in the United States alone is a $4 billion industry. And if more and more women discover that they do not need to rely on the pill to quote unquote regulate their cycle or manage an array of symptoms that they may be dealing with, if they decided to ditch the pill and start using fertility awareness-based methods, that could have a significant impact on the overall revenue streams for pharmaceutical companies. The other issue is the way our healthcare system is set up is, at least in the United States, most physicians don't really have the time to necessarily take with patients to review their chart, to go over their cycle. It's so much easier because they have such a limited time to just simply give the woman a prescription and let her walk out the door without delving deep into what are the issues. And then I think another big concern is the misinformation. Many people associate fertility awareness-based methods, modern fertility awareness-based methods, with the rhythm method. They still refer to it. And in fact, recently there's been some controversy in the United States because the federal government wanted to devote more of the Title X family planning money to educating patients about fertility awareness-based methods. And Cecile Richards, who's the former head of Planned Parenthood, said, well, the administration simply want women to go back to the rhythm method. Well, the rhythm method at the time when it was developed in the 1920s and 30s was a major scientific advance. But modern fertility awareness-based methods are not the rhythm method. These modern methods, whether it's Billings or Creighton, which are cervical mucus methods, or the symptothermal method, which is taught by Justice and SymptoPro and Couple to Couple League. It's also the method taught through the Taking Charge of Your Fertility book, the Marquette method, which is a mucus and hormone monitoring method. All of these modern methods are based on observing specific signs to identify in real time the likelihood that a woman is fertile, so women can use that information. But many people associate modern fertility awareness-based methods with the rhythm method, and they also associate them with being very ineffective. And again, part of that is because the CDC, or the Centers for Disease Control, along with many major medical organizations, continue to promote that natural methods have a 24% failure rate. But when you look at the source of that statistic, it basically comes from retrospective surveys where the majority of women said they were using some sort of a calendar calculation, not using the modern fertility awareness-based methods, which with the symptothermal method as an example have been found to be up to 98% effective, even with typical use based on high quality research studies.
Well, let's talk a little bit about so you mentioned, of course, when we think about the fertility awareness method, there's that immediate kind of like, oh, rhythm method. As someone who's been in this field for almost 20 years, it's interesting because I'm kind of like, oh, we're still here.
Yes, exactly.
But with that being said, there's also a very Catholic religious history to fertility awareness-based methods. And so, for me, I'm young enough that I wasn't even part of that situation. So the first time I discovered it was in a very secular way. So I discovered fertility awareness through Taking Charge of Your Fertility. I was on a university campus, and I remember there was an author that came and she wrote a book, and she was reading the book. And in that book, she just made a little mention of how she discovered that she could chart her cycles and she could not get pregnant. And that sent me to the bookstore. But a lot of people still have that sense of it. And you mentioned it in our pre-chat as well, that's one of the challenges that you face when you're educating doctors, where and especially because you reside and practice in the United States, and there's a huge, I live in Canada, and so there's just, we don't have the same political climate. In the States, you actively have governmental officials that are actively trying to, take away women's rights to just have the right to access birth control in the general sense. So it's interesting that connection you made with Planned Parenthood. Of course, they're going to jump to they're trying to take us back. They're trying to take away our rights. How do you balance that very real possibility that is what the administration is doing with the necessity of improving understanding and awareness about fertility awareness-based methods?
Right. And I think you make a good point. It's all about perception. Interestingly, the Title X Family Planning Office, which is the governmental organization that's about providing family planning services, has always said that organizations that receive Title X family planning money need to provide all of the options to women. Yet over the last 30 or 40 years, there's actually been very little of that money that's been dedicated to providing information about fertility awareness-based methods. And in fact, there have been a couple of studies looking at Title X family planning clinics, and the majority of them do provide all of the artificial methods of birth control, but very few actually provide any real accurate information about fertility awareness-based methods. And so I think that the concern is there's a limited pool of funding, and the federal government was saying, well, we've never really provided funding or provided education about fertility awareness-based methods. So we really should use some of that money to provide information about fertility awareness-based methods. And so I think in fairness, the other side was, well, if you're spending $1 million training teachers to teach fertility awareness-based methods, that's $1 million that we're not using to pay for birth control. Well, maybe those women who would have gotten that birth control would prefer to actually learn a fertility awareness-based method. So I don't necessarily perceive it as the government trying to limit choices. I think they're trying to expand, the choices to include fertility awareness-based methods by, for the first time, actually making sure some of that money is specifically dedicated towards training patients in using fertility awareness-based methods. I think the other point you make about, there's a lot of pushback because people think they associate the Catholic religion with these methods. And so a lot of people will push back, especially when I present at medical conferences. I get a lot of pushback. Well, you're just trying to promote a certain religious ideology. And FACS as an organization, our mission is to share the science. And if you visit our website, factsaboutfertility.org, you can see that's what we do. Our goal is to promote the science underlying fertility awareness-based methods. But because the Catholic Church has been probably the only organization that has consistently promoted natural or fertility awareness-based methods, people will associate it, well, this is just a Catholic thing. Ironically enough, I said that I never heard the term natural family planning or fertility awareness-based methods until I was 29. And interestingly, I was raised Catholic. So the Catholic Church didn't necessarily even do a good job about getting that information out there for women. But I firmly believe as a physician and as a woman, this information should be available to every woman. And every medical professional that provides women's health services should be trained in these methods. Why? I like to say nobody's ovaries are Catholic, so why should we just limit this to Catholics? But I think because of the association, that certainly hurt getting this information out there more broadly.
Mm-hmm. Well, and I think, I'm aware of some of the kind of subtle differences. I mean, I did an interview with Rachel Eyre a long time ago. It's a very long time ago. It's like 2 years ago. And in that interview, she lives in UK and she was trained in natural family planning. And I remember I asked her, I said, so you're trained in natural family planning. Did you find any challenges? Did you need to be Catholic, or were there any differences like that? And she mentioned that, in the country that she resides in, they wouldn't even be allowed to restrict anything based on religion or anything. So it was kind of like a secular thing. Whereas I don't know that it's always that way in the States.
Right.
I don't know. Maybe you could speak to some of it, because I feel like there is some validity to like some of the concerns that people might have if there is a Catholic association limiting women's rights to choices that otherwise they would have, that type of thing.
Right. I think that's a great question. And I think that also raises a question like, well, what is the difference between natural family planning and fertility awareness-based methods or fertility awareness methods? And we get this a lot at FACS. And I think the important thing to note is, and at least at FACS, we use the term natural family planning and fertility awareness-based methods interchangeably. I think the term natural family planning specifically focuses on the natural aspect of these methods and the fact that these methods can be used for family planning. And if you're using it for family planning to prevent pregnancy, couples will modify their behaviors, i.e. if they're trying to get pregnant, they'll engage in sexual relations during their fertile window. And if they're trying to prevent pregnancy, they would avoid or abstain from sexual relations during the fertile window. The term fertility awareness-based methods, I think, highlights that these methods can be used for more than just family planning. And when you're using it from a family planning perspective, again, if you're trying to avoid pregnancy, at least to date, almost all of the studies on effectiveness have been done when women and when couples abstain from sexual relations during the fertile window. In fact, we like to use the term fertility awareness combined method when couples use their knowledge of fertility and combine that with the use of a barrier method, for example, using condoms during the fertile window to prevent pregnancy. And, that's the couple's choice. And what I believe is it's important to educate couples to understand that the effectiveness studies, depending on the method they're using, may or may not have used condoms. In fact, most of them would have used couples that were abstaining during the fertile window. So you may not get the same effectiveness rates, but it's certainly going to lower your likelihood of getting pregnant if you're using a barrier than if you're not using anything during the fertile window. And as for teaching, there are a variety of different teaching organizations in the United States, and some will teach these methods consistent with Catholic Church teachings, and some will teach it to a broader array of individuals. So, for instance, the Couple to Couple League, by its very name, it's couples teaching couples. So, although I know they do some teaching of single individual women, especially if they're having health concerns, primarily they're couples teaching couples how to use the symptothermal method. Whereas SymptoPro is a more secular organization and will teach the symptothermal method to couples or individuals, regardless of their faith-based perspective. The methods developed by Georgetown's Institute for Reproductive Health means similarly the standard days method and the 2-day method. They'll teach that to broad audiences. So there are different teaching organizations that may teach in accordance with Catholic Church teachings, but most organizations will teach to people regardless of their faith. Does that make sense?
Yeah, I really appreciate you taking us through that. And I think it's helpful for especially for someone who's new to the show and this is the first episode they're listening to, like, great catch if this is the first episode you're hearing. But I think it's really helpful just to have those differences in mind, because although, I mean, I completely get it. And I really also like the way that you took us through the aspects of funding and to kind of call it out and say, look, funding is supposed to include all methods, education of all methods. And so if a woman is seeking birth control options, she should be made aware of all methods, but also accurate information about all of those methods.
Right. Can I just make one more comment on that?
Yeah.
It's interesting because it was about 5 or 6 years ago that the Health and Human Services passed the mandate that birth control be provided for free to women in the United States. So women should be able to get their birth control pill or their IUD, and they shouldn't have a copay for it. But the way the mandate was worded is it mandated that all FDA-approved forms of birth control be provided for free. Well, the FDA is the Federal Drug Administration. Well, natural or fertility awareness-based methods don't involve drugs or devices, so they don't need FDA approval. So what we actually saw is that women could then get, their IUD for free. But if I had a patient that wanted to use the Marguerite method, they still had to go out and pay $200 for the Clear Blue fertility monitor because the Marguerite method isn't an FDA-approved form of birth control. So there was discrimination actually against users of fertility awareness-based methods because they still had to pay for their birth control, whereas, users of hormonal contraception, for example, no longer had to pay. So it's interesting. Definitely living in the United States, it's interesting to see. And unfortunately, I think part of it's because women's health and family planning, and especially with fertility awareness-based methods, it's become so political. For me as a woman, as a physician, I really wish we could remove the politics and simply share this information with women. This is information about how their body works. And I think every woman should be entitled to this information, regardless of what she chooses to do for family planning. They should be made aware of this. This isn't something that should be held back because they don't have insurance or they don't believe in a particular faith or they don't have access to teachers. I think this is information that should be made available to every woman. And to do that, we absolutely need more medical professionals that are knowledgeable about the science of fertility awareness-based methods and the real effectiveness rates for family planning.
Well, let's talk about doctors. So you're the work that you do, and I was mentioning before we started our call. So I follow you on Twitter, and like every day you're posting yet another conference, another seminar that you're doing. So you're really out there educating doctors, like pounding the pavement, doing this work day in and day out, and it's incredible. So I want to know from you right there in the field, what is your response from doctors? What is the pushback? Are they totally fine with it? Like, you teach them the science, but this is still a user-dependent method.
Right. Well, great question. Yeah, last week we presented in Albuquerque at a conference called Modern Fertility Awareness for Women's Health and Family Planning. And it was a fantastic medical conference. We had a very diverse group of healthcare professionals, obstetrician gynecologists, family doctors, ER nurses, midwives. We had people that, very much came at this from a faith-based perspective. And then we actually had a woman there that works at Planned Parenthood. So we had a very diverse audience. I think in terms of the pushback with regards to the fact that these methods are difficult to learn or they're complicated because women need to track their signs, I hear that a lot from my medical colleagues. I hear, it's all well and good for your college-educated women to learn how to chart their cycle because their lives are organized and less chaotic, than the poor patients that I may see in my inner city clinic who can't really, keep track of, they can't keep track of where their kids are half the time, let alone, where they are in their cycle. So I get that pushback a lot. And honestly, Lisa, it makes me very angry because what I think it does is it underestimates women and it does not give them the credit for really having the intelligence and the desire to know about their body. And what I tell my colleagues is this is not rocket science. Women can learn to make these very simple observations. And in fact, some of the studies of the effectiveness have been done in probably the most destitute populations. So, for example, the Billings studies that are the highest quality effectiveness studies have been done in India, in which over 86% of the patients were illiterate. So, and they still showed a 90% effectiveness rate for preventing pregnancy, even in a very poor, illiterate population. And what I tell my medical colleagues is, yes, this is a behavior that patients need to learn. These are skills or a habit that they need to develop in terms of observing their signs and charting their signs. It does require, to a certain degree, having the ability to communicate with your partner about where you are in your cycle and their level of support and your choice to use these methods. So in that regard, it is more challenging than, say, getting an IUD placed and not coming back for 5 more years because you don't have to think about it. But the reality is that with any behavioral change, with the appropriate level of support and education, patients can learn to do this. So when my colleagues push back and say, well, they can't possibly learn how to track their cycle, or modify their behavior, I ask them, well, is that what you tell your patient with diabetes, that they can't possibly learn to check their blood sugar or make changes to their diet if it's good for their health? When women realize the health benefits by not having to deal with the side effects of, artificial birth control, I find many women do want to learn. We just need to do a better job of providing them with the appropriate resources and support, including the availability of teachers that are actually trained to teach women these methods. I would love to see a day when not only does every family doctor's office have a diabetic educator in there teaching patients, but they have a fertility awareness educator in their office that can teach patients as well.
Mm-hmm. Well, I mean, you mentioned some of the health benefits, and naturally, and before, in our pre-chat, we were also talking about the connection between your menstrual cycle and your health. And so I'd love for you to talk a little bit about that and how I'd be interested to know how you educate doctors about that connection between the menstrual cycle and health.
Right. Great question. It was interesting because just a couple of years ago, the American College of Obstetricians and Gynecologists came out with a recommendation that young women, in particular adolescents, learn how to track their cycle, that there's a real advantage in women knowing when to expect their menses, how long their menses will last, and how long their cycle will be. Interestingly, though, this is not something that we do regularly, even though there is good research to show that when women learn how to chart their cycle, they can use this information. One of my mentors, one of the physicians that I most admire, her name is Dr. Pilar Vigil. She's an obstetrician gynecologist, and she's published quite a bit in this area and talks about how learning how to chart the female cycle, and in particular the cervical fluid, which is probably the one observation that is common to all of the methods, but with the cervical fluid only methods, the symptothermal method, and the symptohormonal or Marguerite or FEM methods, all of these involve charting cervical fluid. So by being able to chart that, you can not only know the length of your menses or the length of your menstrual cycle, but you can identify the length of your cervical fluid cycle. You can identify your peak day, which can then allow you to identify the length of the luteal phase of your cycle. These have certain parameters that are identify what's normal and what's not. And if you're charting your cycle and all of a sudden you notice, wow, my luteal phase is getting shorter and shorter. Normally it was around 13 or 14 days. On my last couple of cycles, it's only been 8 or 9 days. That may suggest that there's a problem with the progesterone that you're producing, and that may suggest you may be at increased risk for miscarriage if you're trying to conceive. But without charting your cycle, without knowing what's normal, you won't necessarily be able to pick up what is abnormal. And so at FACS, we've developed a presentation. Again, it's called The Female Cycle as the Fifth Vital Sign. And if you recall, Lisa, this is what I shared at the Justice Conference last August. Mm-hmm. And the goal is to show medical professionals that you can learn to read the female chart just like you learn to read an EKG. You go through in a very systematic fashion to identify, is the length of the cycle normal or not? Is the length of her menstrual cycle or her red flow normal or not? Is the length of her cervical fluid cycle or her white flow, is that normal or not? And we go through it in a systematic fashion, and then we discuss if there are abnormalities, what might that suggest is the underlying problem, which can help guide the diagnosis and the testing so it's more appropriate. Again, there's a need for a tremendous amount of more research in this area, but I think this is a promising area of research, especially for women's health, because we can actually get it treating the root cause, whether it's, premenstrual or PMS symptoms or polycystic ovarian syndrome or even endometriosis, or something as simple as just painful periods. By being able to understand the cycle and using the cycle as the fifth vital sign, we can really enhance and provide more comprehensive women's healthcare than we do now. The way doctors are currently trained is if there's anything wrong with her cycle, whether it's irregular or she's got painful periods, we're trained that the pill is the panacea for all that ails women. And we're trained to give women the pill, and that will, quote unquote, regulate her cycle. But it doesn't regulate her cycle. What it does is you're using artificial hormones to shut down her normal hormones. And every 4 weeks, she's having a withdrawal bleed, but it's not a normal menstrual cycle bleed, and it's not necessarily treating the underlying cause of the medical issue. Sure, it may temporarily suppress her symptoms and alleviate her pain and, quote unquote, regulate her cycles, but in the long run, is it really going to help care for her overall health? If she decides in 10 years she wants to stop the pill to get pregnant, have we really helped her by addressing her cycle abnormalities? Maybe, maybe not.
Well, and what I find the most interesting about this tendency for medicine to treat, quote unquote, women with menstrual cycle irregularities with hormonal contraceptives is the fact that the research on hormonal contraceptives specifically contraindicates the use of it in that way. And a lot of the research purposely excludes women who have irregular cycles because they know that women who have irregular cycles who go on hormonal contraceptives are more likely to have a delayed return of their natural fertility. Mm-hmm. And this was known as early as, I looked at some research in the 30s and 40s. This is not new information.
Right. It's interesting because most of the information revolving around fertility awareness-based methods is not new. And in fact, Dr. Eric Odeblad, who is probably, again, one of my idols in the field of fertility awareness, this man has studied the cervix and cervical fluid for over 50 years and has discovered the different types of cervical fluid. I mean, he's been doing this work since the 1950s, and yet it's not something that we really learn about. We did a series, January Cervical Health Awareness Month here in the United States, and you would think in the United States that the only concern women should have about their cervix is getting their pap smear or screening for HPV, as there's really no mention about the important role of the cervix and cervical fluid in a woman's fertility. We're trying to look at that more and more. And with regards to using hormonal birth control to regulate a woman's cycle, we see this all the time. What saddens me, Lisa, is that we see a lot of girls at 12, 13, 14, 15 years old who have quote-unquote irregular cycles that are being put on hormonal birth control to quote-unquote regulate their cycles, when in fact it is normal for young girls who have just started menstruating within the last 2 years to have cycles that can range from 21 to 45 days. Their brain and their hypothalamus and their pituitary axis still needs time to mature. And by introducing potent steroid hormones that are available through hormonal contraception, we're not helping the axis mature again. We're suppressing the normal functioning of the reproductive system and giving them exogenous hormones, which in the end may not really help them, and in fact could hurt them and could lead to a delay in fertility and a host of side effects that I know you've talked about in some of the presentations you've given. Holly Griegspell talks about in her book, and that frankly it's available in the medical literature. In our presentation, The Signs of the Female Cycle, Facts provides, this is a presentation geared for a general audience, and we list all of the side effects of hormonal birth control that are reported in the medical literature in peer-reviewed published studies, and it's quite a list. And then we also quote a statistic that's been found and published in the medical literature that shows 2/3 of women will stop hormonal birth control within the first year because of the side effects.
Mm-hmm. Yeah, it's a very interesting and controversial topic. And earlier you were making mention of the presentation that you did for us, the menstrual cycle is the vital sign. And I remember sitting in that presentation, and what I really liked about it was that you had pictures of charts, and you would go through each chart systematically, just as you said, and said, you'd look at all the different parts of the menstrual cycle based on what we know is normal in terms of like, how many days is this part? How many days is this part? Or, what is the quality of this? And dissecting it, like you said, like an EKG, as you were talking about. So when girls are put on the menstrual, or when girls are put on hormonal contraception before their cycles have fully matured. Now, this is not scientific. This is an observation of a fertility awareness educator. But when I'm working with women who were put on hormonal birth control quite soon after, so that their cycles didn't have an opportunity to really mature, when they come off of it, you often, like, there's no standard, every woman is different, but you see these patterns, you see these shifts. And ultimately, that is the kind of that practical application of the menstrual cycle as a vital sign, to be able to see those trends and understand what they mean. And hopefully that can help us to really treat the menstrual cycle differently. I would imagine with the work that you're doing, I mean, the goal is that one day we start to recognize that the cycle is actually really important.
It is.
And if you chart the cycle and make that a part of what you're doing, it's almost like everything that we do, everything that medicine has done, it's trying to ignore the fact that we have cycles as women.
Exactly. And that in order to be equal to men, women can't have cycles.
Yeah.
But that's what makes us unique as women. And, we fail to recognize that ovulation is a sign of health. Ovulation is probably the seminal event within the female cycle. And this is, for those that aren't familiar, though I'm sure your audience is, ovulation is when the egg is released. And that can only happen if all the hormonal events preceding that, it's a very intricate orchestration of hormones that have to occur correctly in order for ovulation to occur. But it's critical, because when the estrogen is rising, not only does it have an effect on her uterus and on her cervix and on the ovaries, but it has overall effects on her health. So we seem to lose sight of the important role of women's hormones. And we seem to forget that hormones matter. The woman's normally produced hormones, her follicle stimulating hormone, her luteinizing hormone, her estrogen, her progesterone, these are very important for her overall health. And we know this because we see when women go through menopause, once women go through menopause, their risk of certain health conditions like heart disease goes up dramatically. Why? She no longer has the protective effect that the estradiol has provided her over the last 40 years. And so when we start shutting down women's hormones in their teens and their 20s and their 30s, not only are we making them infertile so that they can't get pregnant, which was the original purpose of birth control to begin with, but we're potentially playing havoc on her overall hormonal health. Personally, I think we need to go back to recognizing the female cycle, the way that it is designed to function normally. And this is the vision of facts. Our vision is that the female cycle, fertility will once again be viewed as a normal and healthy part of, the normal functioning of the woman's body. But now we see a woman's potential fertility as a disease that we need to give her a drug to suppress, or we need to insert a device to prevent, not recognizing the potential effects, whether it be on her physical health, her emotional health, her mental health. There's been research that's come out in the last year showing women who take hormonal birth control have a significantly increased risk of depression. Women who take hormonal birth control still have an increased risk of breast cancer. But we tend to ignore this, and we do it, not only at our own peril, but at the peril of the women that we're seeking to care for. And again, from my medical colleagues, I think, like me, I prescribe birth control. I thought I was really doing the best that I could for these patients. If she had painful periods, well, let me give you the pill. If she had irregular cycles, well, let me give you the pill. This is what I was trained to do. But now that I know about fertility awareness-based methods, if a woman has irregular cycles, I'm like, well, let's chart your cycle, because I want to see which phase is irregular. Let's, drill down and figure out where may the hormonal imbalance be, what might be the underlying cause, so we can get at that root cause and treat the problem, as opposed to treating the woman's fertility cycle as the problem.
Mm-hmm. Well, and what you spoke about in terms of this tendency to use these methods to treat, even in spite of the fact that the risk of certain cancers goes up. In the research that I've looked at, it's framed in a very particular way. So, oh, well, women who use hormonal contraceptives are shown to have an increase in these types of cancers, but a decrease in these ones. So the net effect of the hormonal contraceptives is still positive. That is pretty much a direct quote from a research paper that I read. So they're putting a spin on it, even at the research level, and then that filters down to the practice. So I remember from when we were together at the conference, one of the challenge, I mean, you kind of just touched on it, but some of the challenges that you face, because you've tackled, like, you're targeting doctors, like in the work that you're doing, you're targeting doctors. And one of the things that you mentioned was that you kind of switched your focus to target primarily on, medical students. So maybe you could share with us some of the challenges that you found in targeting doctors and in trying to change this crazy medical arm, like, that's already in full swing, total birth control pill focus. Like it's a really big task you're taking on.
Yes, it is. And I think it's particularly challenging to try to reach medical professionals because you become very accustomed and very comfortable in the way that you practice. As a physician, for instance, we don't learn very much about acupuncture or nutrition in our medical education. But there are patients that I refer to functional nutritionists because I know that's the help that they need. But most doctors, we do tend to be more reliant on, what is the best pharmaceutical agent that I can use? What is the quickest, easiest, effective option, for caring for my patients? And I think, with medical professionals in practice, they've just become very set in their ways. It's hard to change their mind. The other thing, and this is kind of, to a certain degree, the elephant in the room. When I teach medical students, I oftentimes will bring in a panel of medical professionals that integrate fertility awareness-based methods into their practice. And many of these medical professionals that are actively using fertility awareness-based methods in their practice do not prescribe birth control. And I've had medical students ask, well, can you bring in doctors that, equally prescribe birth control as they, offer fertility awareness-based methods? And I think the challenge for doctors is it's in how we view the woman's, reproductive health system and the woman's fertility. I think it's difficult for doctors to look at some women and say, well, your fertility is a normal, healthy part of the way your body is designed to function. So I'm going to teach you how to chart your cycle and use this information to monitor your health or plan your families. And then on the other hand, talk to some patients and say, well, your fertility is a problem. So I'm going to give you this pill to shut down your reproductive health system. It creates this disconnect for the doctors. Now, for me personally as a physician, I will use hormonal medication when it's necessary to treat an illness because, we have them as medications, and I believe medications should be used to help heal people, not to harm them. So I certainly will use hormones when it's indicated to treat medical illnesses. But I think for a lot of doctors, it's difficult to do both because it's how you view the woman's reproductive health system. Is it a normal, healthy part of the way her body is designed to function, or is it a disease that I need to control? And so that makes it tough. And we decided to focus our efforts on medical students because, this next generation is so, they're not only very health conscious, but they're very conscious of their environment as a whole. They're very concerned about, the chemicals that are in their beauty products, the chemicals that are in their food, the hormones that, may be used in the meat that they're purchasing. So we've got medical students that will spend extra money to buy organic food that has no hormones. And then they have that aha moment when they realize, well, but I'm taking a pill that's full of artificial hormones, even though I won't buy meat that might have artificial hormones in it. So the students tend to be a little bit more open to the idea that maybe artificial hormones aren't all they're cracked up to be. I understand the intent originally in developing birth control was to free women, was to empower women, was to allow women to live the lives that they wanted to have the careers that they wanted to live. But I think what it's done is, we've placed our trust and our control in a chemical or a drug or a device rather than giving that power to the woman. And I think with fertility awareness-based methods, we really empower women. We give them information about how their body works, and then they use that information, in cooperation, obviously, with their partner to plan their lives. It was interesting because Melinda Gates recently tweeted out how birth control allowed her to, have the career that she wanted and have the children she wanted spaced when they were wanted. And you may have seen my tweet in response. I said, gee, Melinda, you could replace birth control with fertility awareness-based methods for me, and I can say the exact same thing. Fertility awareness-based methods have made it so much easier for me to address some of my health concerns related to my reproductive health, and it's also allowed me to plan my family and have the career that I wanted to as a physician. But I don't think it should be limited to me as a well-educated person. I think every woman should have this information available to her, and every man, in fact, if they're interested in learning. And it's surprising how many men do want to learn, because they do care about the women in their lives, and they don't necessarily want them, taking, chemicals that could potentially be harmful to them. So I think we just simply need to do more. And that's why I love being on your podcast, and I love what you do, because you are spreading the truth about fertility awareness and how these can be effective not only for women's health, but for couples who are interested in using these methods to plan their families.
Well, and I think there's so many things that you highlighted there that are important. And I think the biggest aspect of it, and I think we share this belief, it's that regardless of what a person plans to do with this information, regardless of whether or not you ever intend to use it for birth control or trying to conceive or anything, we all have the right just to know. So when I went to school, I didn't have much choice. I had to learn how my eyes worked and my ears worked. And I was in my biology class, and I remember learning all the parts. We're all capable of learning the function. And it's sad that we live in a world where medical doctors are not learning the degree of intricacy to the cervix and cervical mucus, as you mentioned, that Dr. Odblad has brought to our, it's interesting that you have to kind of go to fertility awareness school to learn about that detail of cervical mucus production, when obviously in medical school, I never went to medical school, so you can attest to the level of degree complexity of all of the different things that you had to learn about. It's the elephant in the room. There's a bigger question there as to why this knowledge isn't available, right? There's a much, much bigger and deeper meaning to this as a woman in the world, to know that still in 2018, as we record this, that this is something that is absolutely not taught. And what is taught is to basically ignore and get rid of the cycle. So I feel like this is a much, much bigger issue related to misogyny, and it's like the patriarchy. Yeah. It's the patriarchy.
I think it is a much bigger issue. And I totally agree. I think this information should be available to every woman and every young girl. And I think I've told you this, Lisa, I am a passionate advocate that we need to be teaching our young girls to chart their cycle, as soon as they go through puberty, so that it's not something that's scary or fearful or something that, they have to reject, but it's something it's a beautiful part of the way that their body is designed. And, they can use this information, for their benefit. And I think this is really about empowering women. But like you said, there's so many barriers. We need to get past, the barrier that these methods are not effective for preventing pregnancy. The effectiveness rates based on the highest quality research studies show that these methods can be 86 to 98% effective. And so, FACS has launched a petition along with Natural Womanhood asking the CDC to please update the data on the effectiveness rates. Now, that being said, these methods are only going to be effective if you learn from a trained instructor, depending on the method, you're motivated to use the method, and you have a partner that's going to be supportive in your use of the method. Those are critical factors, but I don't think we can presume that certain patients won't be able to learn the method or certain partners won't be supportive. And so therefore they shouldn't even be offered, an opportunity to learn these methods. I think every woman should be offered an opportunity to learn these methods. And if they choose to use something else, so be it. But let's give them information. Let's allow them to make a truly informed choice when it comes to their family planning. And along those lines, let's inform them about the real risks. The World Health Organization classifies combination hormonal birth control as a group 1 carcinogen because it has been proven to increase the risk of breast cancer and cervical cancer and liver cancer. And while it has also been shown to reduce the risk of endometrial and ovarian cancer, the incidence of those diseases is so much less. So it's not, they don't neutralize each other out. Now, you may have some women, even if they know that the birth control pill increases their risk of breast cancer, they love what it does for their skin, and they're going to say, or they love that they can predict when their period is going to be. And so they're going to say, no, I'm still going to take that risk. That's their choice, but again, like the birth control pill is a risk for cancer, just like tobacco. And we inform women and men, of the risk of smoking cigarettes. And yet there are still people like my mother, for instance, who as a nurse knew the risks of cigarette smoking, continued to smoke for 50 years, developed lung cancer as a result. But as difficult as it is, she made an informed choice. So I think if women are given information about all of the family planning methods and choose to use the method that they desire because that's what fits best for their lifestyle or, for their well-being, then so be it. But right now, women are not being fully informed about the option of fertility awareness-based method, the real effectiveness rates, and the potential harms of hormonal birth control. And that's because medical professionals, doctors, nurses, midwives, etc., are not learning about these in their training programs. And again, that's why we started FACS, because I felt people shouldn't have to wait until after they have an MD after their name to hear about fertility awareness-based methods for the first time. This is something that should be rooted in the medical education process. And it needs to be based on the best science, and it needs to be presented in a neutral manner so that medical professionals can provide accurate, up-to-date information and empower women to make informed choices when it comes to their reproductive health.
Love that. Love it so much. Well, as we bring our interview to a close, I mean, I could talk to you all day, trust me. I think we did.
I think we did when we were in Canada. We talked quite a bit. I loved getting to meet you.
But yes, I could just keep asking questions. But, based on everything we talked about today, I feel like we talked about a lot. I feel like the listeners are going to get a lot from this interview. But is there a kind of the last word, most important thing, or a note that you'd really like to end on based on everything we've spoken about?
Well, I think since I'm speaking primarily to an audience of users, I would encourage you to not give up on your medical professional and to help them learn more about fertility awareness-based methods. Certainly, please refer them to our website, factsaboutfertility.org. We did develop a medical update in conjunction with Natural Womanhood, where we highlight the effectiveness rates of the various methods based on the highest quality research. We're actually going to be putting together a package that will be available for purchase on our website to share the facts with your medical professional, which will include some of our resources, including our research article that summarizes the effectiveness. FACS, as a nonprofit, we do not have a ton of funding. We certainly do not have the funding that pharmaceutical companies have to hire young people to go out and detail doctors in their offices. So I would ask your listeners to help us do that, to help us share the facts about fertility awareness-based methods with your medical professional. And to do that, please visit our website, factsaboutfertility.org, for the resources. Again, we're offering webinars, both for medical professionals and students, as well as for the general audience. And we've got 80 trained speakers across the United States and Canada. We have a couple of speakers in Canada. So if you would like to invite a speaker to speak to a medical audience or to a student audience, please do contact us at speaker@factsaboutfertility.org. We would love to be able to share this information more broadly, but to do that, we definitely need your help. So I would like to just simply close with that. And thanks again for having me. It's such a joy to be with you.
Well, perfect. Thank you so much. And so one more time, the website that our listeners can go to get information about you
is FACTS, F-A-C-T-S, aboutfertility.org.
Okay, great. Well, thank you so much, Marguerite, for being here. It's always a pleasure to chat with you about fertility awareness and whatnot.
Great. And if they'd like to email, they can simply email info@factsaboutfertility.org, and I will get that as well. So happy to hear from your listeners. Thank you so much, Lisa.
Okay, thank you, Marguerite. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/194. I hope that you enjoyed today's episode with Dr. Marguerite Duane. It was such a pleasure having her on the show for the second time. It was really a great opportunity to meet her in person several months ago when we attended the Justice Conference together. Marguerite she's just got such great energy, and you can just feel her passion coming through for what she's doing. And the work that she's doing is really incredible. I don't know how she has the energy and how she's always traveling all over the place to educate doctors and do all these programs, but she's doing amazing work in this field. And it really gives hope for all of you who are listening who have had struggles and challenges, having your practitioners acknowledge even your charts. I know I speak to a lot of women who've tried to take their charts into their doctors, into their appointments, and just to be told that, I'm not looking at that, or I'm not sure why I would even look at that. And ultimately, it makes a lot of sense if you consider what we talked about in today's episode. Most practitioners are not trained to read the menstrual cycle chart. And as Dr. Duane was talking about in our episode today, the menstrual cycle chart provides so much information about a woman's health that it can be read in a very similar way that a doctor can read an EKG. And so that's, for any of you who don't know what an EKG is, EKG stands for electrocardiogram, and it's a test that records your heart's electrical activity. And so, in this way, you can think of your menstrual cycle very literally as a vital sign, because just in the same way that your different medical testing can show you what's happening in your body and can be very sensitive to different changes that are happening in your stress levels or in your heart rate and things like that, your menstrual cycle chart is just as sensitive to the effects that are going on in your life. And so anyone who's ever charted their cycles will see that. So really happy to have Marguerite on the show and to chat about these topics. Really important work that she's doing. And I'm just excited to see where this goes. The more doctors, the more medical practitioners, the more functional doctors that are trained in the menstrual cycle, who have a good understanding of how important the menstrual cycle is to overall health and what a great indicator it is. It's kind of like an early advanced warning system. If there's something wrong with your cycle, it can give you, the first warning, the first response, the first idea that something else is going on in your body. And so if health professionals are not jumping on and really utilizing this tool, they're really missing out on a large degree of extremely important information. And of course, I just want to say a special thank you again to our sponsor, Dow Labs. So for more information, make sure to head over to mydowlabs.com. That's mydao-labs.com. And of course, if you're wanting to join us in Fertility Awareness Mastery, this is the last call. So head over to fertilityfriday.com/group program, and you can slip in under the wire to join us as we get started in our programs next week. And I just want to thank you for listening to the show, for spending some time with me today. I really appreciate all of you for sharing the show with your friends. It's because of you that I keep podcasting. And also, when you share the show with your friends, it really helps to spread the word and just to share this incredible and important knowledge with as many women as humanly possible. So I really appreciate all of you in supporting me with my efforts just to really spread the word and raise awareness about the importance of fertility awareness, the importance of paying attention to your menstrual cycle, and really understanding that deep connection between your menstrual cycle and your overall health and fertility. So thank you so much for being with me today. And as always, until next time, be well and happy charting.